Funding for Yale Cancer Answers is provided by Smilo Cancer Hospital. Welcome to Yale Cancer Answers with Dr. Anees Chagpar. Yale Cancer Answers features the latest information on cancer care by welcoming oncologists and specialists who are on the forefront of the battle to fight cancer. This week, it's a conversation about the role of palliative care in cancer survivorship with Laura Donnelly and Kristen Madrid. Laura and Kristen are oncology social workers with Smilo Cancer Hospital, and Dr. Chagpar is a professor of surgical oncology at the Yale School of Medicine.
So maybe we'll start off by each of you telling us a little bit more about yourself, your backgrounds, and what it is you do. So Laura, maybe we'll start with you.
Sure. I have worked as an oncology social worker for probably about the last 10 years. And I currently work with the palliative care team. And so my role is that, palliative care is really an extra layer of support for patients who have any type of cancer diagnosis. So palliative care helps with a lot of really difficult symptoms. They add extra support if a patient is really approaching end of life, and also help the more complicated pain management situations. So I work with that team. So I therefore work with patients with all different types of diagnoses and all different ages. And it's really, really wonderful work.
Fantastic. And Kristen, how about you?
So I work with our breast medical and surgical oncology teams. I've been working in oncology for a little over a year now. With the breast population, I have the privilege of working with a variety of different women primarily, and some men. I get the privilege to work with individuals from the initial date of their diagnosis and beyond, whether it's through active treatment, whether, sometimes I do collaborate with Laura quite a bit through palliative care programs. I do work with a lot of women who are going through varieties of different treatment, whether it be chemotherapy, radiation, endocrine therapy, surgery. And I do work with them up until they enter into either the phase of survivorship or continued treatment as well.
Fantastic. So Laura, you mentioned that you are involved in palliative care as this extra layer of support. I think palliative care has had different perceptions in the public and in the lay media. Can you talk a little bit more about how patients perceive palliative care when they're approached to actually meet with you? How does that conversation go?
Sure. Yes, I think there is, or there can be, a perception, out there that palliative care means end of life or heading towards end of life, and that is not really the whole scope of palliative care. Really, palliative, I think, is really meaning symptom relief. So we see many patients who have very curable cancers, but the treatments and the disease itself can be really painful. And the primary oncologist can really try to alleviate that pain, but the palliative care physicians are really specialists in that. So palliative is really symptom management, and it does not necessarily indicate that a person is at end of life, but sometimes that is the perception. More and more, I'm finding patients to be really open and receptive and happy to have the extra support or an extra specialist to kind of take a look at how they're managing symptoms. Every once in a while, a patient will say, "Why are you referring me there? Are things not going well? Does it look like, I'm going to end of life?" And I think the oncologists do a really wonderful job of educating patients really about the full scope of palliative care and how it can be beneficial for them. So it doesn't seem to be a really difficult, barrier to get over. But yes, it's certainly brought up by patients occasionally.
Yeah. And Kristen, can you talk a little bit more about the role of the social worker in the team and what you bring? You had mentioned that you work with the breast team and the medical oncologists and the the surgical oncologist. Talk a little bit more about the role of a social worker and what exactly that entails.
Sure. So primarily, I always like to introduce myself as a support to the patient. When you get that diagnosis, there's a slew of different emotions that rush through your mind and that you experience. And it's very overwhelming to even name it as cancer. And I have a lot of patients that call it the C word. And there is a lot of work that goes into providing that level of support to somebody going through something like this. And it does impact you not just physically, which is also a big key piece of this, but also emotionally, financially, sexually. The mental health piece is something that in our field we do like to primarily focus on. And when you are diagnosed with cancer, it does have an impact on your mental health. So the role of the social worker is to help an individual, a patient, tackle the mental health impact and effects that come from a cancer diagnosis, whether it be depression, anxiety, a lot of worries, a lot of fears, concerns with self-image, depleted self-confidence. In addition, as well, to the support and mental health piece, as I mentioned or alluded to, cancer can impact you in other ways. So there's a lot of financial toxicity that results from this diagnosis, which we can help address. There's, barriers to treatment like transportation, housing, cost of medical care, insurance barriers, whatever it may be. We can help to address and hopefully tackle some of those barriers to ensure that our patients have access to the medical care that they need. I will say a lot of it is most definitely guiding them and supporting them through this diagnosis, helping them digest it a little bit more than, they may have when they first heard that information or that news. Helping address any residual effects that may have come even post-treatment as well, fear of cancer recurrence, fear of disease progression, again, some of those physical changes that may occur, those latent effects of treatment that may present themselves once an individual is complete with treatment or entering again into that phase of survivorship. So the role of social work is vast, I will say, but primarily, to reiterate, we are there to serve as a supportive advocate for our patients.
Yeah. And Laura, coming back to you, when you talk about palliative care being really symptom management and that extra layer of support, I think that there's a real tie between what Kristen mentioned in terms of supporting patients in terms of their mental health as well as their physical, emotional, sexual, financial health, etc. But can you talk a little bit more about the mental health kind of challenges that patients face when they're going through their cancer journey, particularly when they're facing physical symptomatology, either from the cancer itself or from the treatment, and particularly when they are looking towards the end of life? Granted, the provisos that we mentioned earlier, which is that palliative care is far more than end of life, but can you talk a little bit more about the mental health support that you provide to those patients in that journey?
Sure. So like Kristen just explained, a patient with, let's say, a breast cancer diagnosis that she would encounter, and she is there to provide that initial support. And maybe down the road, that patient gets referred to palliative care, either because they're experiencing maybe a lot of nausea, a lot of pain, even anxiety related to their diagnosis, and perhaps the physician thinks it would be a good idea for that person to get connected with palliative care. So they make a referral, and on the first visit, I do try to meet with the patients to introduce myself, even though they perhaps already have worked with Kristen and have been maybe processing some of those things. But like Kristen did mention, depression, anxiety, fear, all are very appropriate and normal emotions when you're living with cancer. I think when patients get into really the active phase of treatment, it can be very consuming. It can really consume their whole life. They maybe went from working and raising children to now they're really, going to doctor's appointments and feeling pretty poorly at home in between, and kind of really feel like there's not a lot of quality to their life. And many people are willing to do that if there's going to be an end in sight and they're going to recover and resume their prior level of function. It does become more difficult when it looks like treatment may go on indefinitely. And another thing I don't think I mentioned was that palliative care is also very concerned with a person's quality of life and also really engaging the patient and the family in a discussion about, what does a good day look like for you? What matters to you? What's important to you? And as people go through cancer treatment, those priorities really shift. And people really take a look at, what mattered the most in their life. Also, a lot of spiritual and existential type questions can come up. And I think for patients that even, have a very good prognosis and really the intent is cure, I think getting that diagnosis brings people face to face with their mortality a little bit and sometimes just brings up questions about, are really my affairs in order? What do I really want if I approach, end of life? Where would I want to be? How much care would I want to get? How much interventions? So those are maybe some of the things that in palliative care we dive into a little bit more deeply, where, and also really making sure that our patients have appropriate support, even outside of our clinics. Kristen and I are available in the clinics, but sometimes people would benefit from really ongoing counseling with someone in the community who is an expert or very knowledgeable in patients or people living with chronic illness, and or medication to manage symptoms of depression. Sometimes we make referrals for that as well. So that's all a part of how we address mental health issues, I think, both in the primary clinics and in palliative care.
And, Kristen, coming back to something that you said that I think is really important is the whole idea of financial toxicity. I mean, we often think about a cancer diagnosis and we think about the pain, the physical and emotional toll that diagnosis has on the patient and the family. But we also know that there's a significant financial toll. And that toxicity really does play a key role in terms of people's quality of life. Can you talk a little bit more about the role that you have in terms of helping patients through that financial toxicity? What do you do for patients that don't have resources, that may be underinsured or uninsured, who may be even undocumented, so not even able to access insurance? Can you talk a little bit more about that?
Sure. So it definitely is a very complex issue. And what we do is a variety of different interventions. For our particular health system, we have wonderful access to our billing departments and financial assistance departments who provide a great deal of assistance to those individuals who, as you mentioned, may be undocumented and do not have access to health insurance. We'll aid the patient in completing necessary applications to help gain medical coverage under our healthcare system. Or if we do have an individual who's maybe underinsured, we'll connect them with, again, our billing and financial assistance office to help get them in either a payment plan, a sliding scale, or some form of discounted care. Additionally, we always like to meet patients where they're at and see and, almost act like detectives and try to investigate, what other resources can we connect this individual to. We're lucky in the breast cancer population to have access to so many wonderful nonprofit agencies who connect and provide our patients with financial grant awards. And there are other numerous organizations out there that are able to provide that to patients of different disease types as well. There's a lot of national organizations that patients can access, like American Cancer Society, Cancer Care, to pursue different financial resources that will help connect them to. There's also the possibility of aiding the patient or guiding them through the process of applying for something like Social Security disability, whichever, state program they may be eligible for and benefit from, we can help connect them to as well. So there's quite a few different resources and tools and organizations out there that we have the information on, but the patient may not. So our goal at the end of that visit is to make sure that they leave there feeling well equipped and with adequate resources to help better and lessen that burden of financial toxicity.
Fantastic. Well, we need to take a short break for a medical minute, but please stay tuned to learn more about palliative care and social work with my guests, Laura Donnelly and Kristen Madrid.
Funding for Yale Cancer Answers comes from Smilow Cancer Hospital, where their survivorship clinic is a resource for cancer survivors and provides patients and their families with information on cancer prevention, wellness, supportive services, and health research. SmiloCancerHospital.org. Genetic testing can be useful for people with certain types of cancer that seem to run in their families. Genetic counseling is a process that includes collecting a detailed personal and family history, a risk assessment, and a discussion of genetic testing options. Only about 5 to 10% of all cancers are inherited, and genetic testing is not recommended for everyone. Individuals who have a personal and/or family history that includes cancer at unusually early ages, multiple relatives on the same side of the family with the same cancer, more than one diagnosis of cancer in the same individual, rare cancers, or family history of a known altered cancer predisposing gene could be candidates for genetic testing. Resources for genetic counseling and testing are available at federally designated comprehensive cancer centers, such as Yale Cancer Center and at Smilow Cancer Hospital. More information is available at yalecancercenter.org. You're listening to Connecticut Public Radio.
Welcome back to Yale Cancer Answers. This is Dr. Anise Chagpar, and I am joined tonight by my guests, Laura Donnelly and Kristen Madrid. We're talking about the role of palliative care and social work for patients with cancer in honor of Cancer Survivors Month. Now, before the break, we were talking about social work and palliative care really being this extra support for patients as they go through their cancer journey, and whether that's to help alleviate some of the physical pain or the mental anguish or even the financial toxicity of the diagnosis itself. But Laura, I wanted to come back to you. I think we need to keep in mind that cancer affects all patients, all races, all ages, all body types, all financial situations. And, I think it really affects different people differently. Can you talk a little bit more about your role and what you've been doing in terms of the pediatric and young adult population and how that population might be different from the adult population?
Sure, absolutely. You're absolutely correct saying that cancer can really affect anybody, regardless of background, age, socioeconomic status. Really, unfortunately, it's really a common disease. And one population that we're seeing cancer in a little bit more. I think there have been some articles even in the New York Times. I saw one about people who are younger, maybe in their 20s and 30s, having a cancer diagnosis. And I think in past eras, decades, it was a disease that was more commonly seen in older adults. And that young adult age, I'm going to say from like 20 to 40s, is a really unique period in a person's life. Typically, a person is pursuing their career, raising a family, perhaps, those types of things are really kind of front and center for them. So a cancer diagnosis at that stage of life is very, disruptive to, it can be an entire family system if there's young children involved. It can be really career disrupting, things of that nature. So we do find in, I would say, the population of 20 to 50, there are some unique challenges. Also, the peer group in that age range are not as familiar with cancer. I think a person in their 20s who may have a lot of friends, those friends may not really know how to support their friend going through cancer. They're likely haven't gone through it themselves. They maybe have had a family member, but so that age set really has some unique challenges. And most recently, our cancer center has really tried to make a greater effort to meet those needs in the way of some new support groups geared specifically to those age groups.
Yeah. And Kristen, I would think that as part of some of those special circumstances, things that you might face are, how do you talk to your child? So you deal with the breast cancer population, and I can only imagine that there are people in that age group that Laura was talking about who might have young children, right? And now mom has a breast cancer diagnosis. How do you talk to your kids about that? On the one hand, you're scared. How do you help your kids get through that? Because I can only imagine that they too might have some fear and anxiety.
That definitely is very real for parents. Parents with young children specifically, or adolescents. Even children who are above the age of 18 and considered adults. It's terrifying to hear that your parent has cancer. So we usually, provide a few different recommendations to those parents. Because they often endorse the fact that, cancer isn't their primary concern, it's their kids. How do I tell my children? How do I help them navigate the physical changes and treatments that I go through? And that depends on definitely the child's age and developmental level. But broad recommendations, I should say, are to keep a line of communication open with that child. A lot of kids, again, depending upon their age or developmental level, may not verbalize how they're feeling or, the fear and the worry that they're experiencing. So it's good to, carve out protected family time with your children. Make sure that you keep that line of communication open. Try to tease out some questions they may not be asking, but you can see maybe written all over their face that they're worried or they're concerned about their parent or their guardian. Definitely try to maintain the child's schedule, as best as we can, given, of course, the huge impact that the treatment schedules and this diagnosis may have on the day-to-day. Utilize your support system and the child support system. Schools have been a really great benefit and help to a lot of kids when their parents are going through cancer. Teachers, specifically school counselors, school social workers, we always encourage reaching out to, the friends and of your children, their family members, having them try to provide an extra layer of support or, utilizing your inner circle of friends and family and your child's inner circle to really maximize the level of support available to the child, but also to the parents. And, just again, try to realize at the end of the day that, you're doing the best that you can given the circumstances that you're facing currently. And just make sure that, you keep prioritizing that family time with your child because, that relationship you have with them doesn't have to change at the end of the day. And at the end of the day, you guys will still have one another to support yourselves through this.
Laura, thinking about how that situation could turn 180 degrees when the child is the one facing a cancer. And we know that pediatric cancers do occur. And sometimes those pediatric patients, I can imagine, may end up coming to you in palliative care as well. And for them, it's, trying to get through the diagnosis of cancer. But I can only imagine the anguish that parents might be feeling, seeing your child go through this diagnosis and potentially facing their own mortality. Can you talk a little bit more about that experience and how you help families through that?
So in the role that I'm in, I really work exclusively with adults. I do know that pediatric palliative care is an emerging field. There is palliative care for pediatric patients. But in the role that I'm in right now, I really work just with adults, and helping them communicate with their children. So I don't have that experience of pediatric patients.
Yeah.
Yeah.
But I can imagine that, the social workers and the palliative care team must do a similar kind of really engaging the family in this journey. Kristen, very much like you were talking about, kind of wrapping around that whole family. I guess the other question, even for the patients that are in that adult yet younger adult population, Laura, can you talk a little bit about what it's like for a 20-year-old who might be facing end of life? I mean, that's almost like, wait a minute, I just got here. I haven't lived my life yet. I haven't achieved all my goals yet. Can you talk about how you kind of help them get through some of those feelings?
Yes. I would say a 20-year-old, really maybe in the middle of their college experience or maybe their young working life, and get a diagnosis. And that is really challenging because a person at that age is really a lot of times half dependent on their parents and half independent, right? And so I think one thing that I've done before is really sometimes taking the patient aside and speaking to them, aside from their parents, and allowing them to really just share what this experience is for them. It can lead sometimes to some increased conflict, I think, between a parent and a child in that situation, because the child is really wanting some more autonomy, but really needs the parents in this situation. So I think it's really giving them the most voice and the most say in their wishes and their desires. They are still young and they are still really figuring out who they are and who they want to be. So it is a really, I would say, delicate, special time and a really difficult time for the families. So I would say that's how I approach it, really supporting both, but also somewhat separately.
Yeah. And Kristen, when you were talking about all of the resources that you provide your patients, from a financial standpoint as well as from a mental health standpoint, can you talk a little bit more about how patients should advocate for themselves? What advice would you have for those kinds of people?
I would encourage them to ask more of the broad question of, what is there to support me here in this care center, in this healthcare system? Each healthcare system has a variety of different social workers, nurse navigators, social worker navigators, oncology navigators, case management. So it's very much dependent upon what your care center offers, but I would definitely encourage them to ask. And I have no doubt at that point they can get guided in the right direction and provided with adequate referrals to help address a lot of those needs.
Kristen Madrid and Laura Donnelly are oncology social workers with Smilow Cancer Hospital. If you have questions, the address is canceranswers@yale.edu, and past editions of the program are available in audio and written form at yalecancercenter.org. We hope you'll join us next time to learn more about the fight against cancer. Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital.